mean, it was bound to happen because that region is full of conflict, and there are a lot of issues that have been happening there. So unfortunately, the authorities haven't been able to go in and do the preventive work they need. So those areas, in terms of vaccines and educating the people, it's been very difficult for them. In fact, last week, 2 Red Cross workers were attacked, and 3 of them were quite badly injured because they were trying to address this issue. So it's bound to happen that when you have conflict plus an outbreak situation, it will be very challenging.
I think it's even more than that, because I'm hearing that some of the case contacts, people who have contacted people with Ebola virus,
yes,
avoided getting vaccinations, and they kind of fled from for follow-up and all that. How do you think that more education still needs to be done to let people know about how important it is for them to allow the health officials check them for this?
Yeah, it's a very challenging thing because you're up against cultural beliefs, traditional beliefs, and you have all these foreigners in their land, and they're already under pressure with the conflict situation that's going on there. So when these people are coming and telling them, oh, I have to inject you to protect your life, they don't really understand how and why. And then, they're not able to bury their loved ones who die from the virus the way they would like to. So all of those things contribute to a lack of trust, essentially, between the people and the authorities.
So it's going to be a hotbed there right now. I'm hearing
Yes.
they're preparing the beds, coming in there. What do you think how do you think these efforts will help mitigate the situation there?
I think they're doing the best that they can, but at the end of the day, it's going to be a very challenging and ongoing situation, which is why this outbreak was so worrisome from the start, because of the region where it's taking place.
When you look at the the response so far on this current outbreak compared to the last one, would you say the response has been much better than the others?
Oh yes, definitely. I mean, even just the simple fact that more than 15,000 people have been vaccinated. We didn't have the vaccine before. We didn't have some of the new styles of isolation centers that they're building, including the one you said that they're now expanding. So it's definitely improved. It's just, unfortunately, it's now in an area that's even more challenging than before.
So how do you think regards funding, how have the funding rounds been for this outbreak?
The funding is there. The funding is there. Luckily, people have, the international community has stepped up. WHO is there on ground. MSF is there on ground. So all the key players are around, putting all their resources into this effort. I think it's just going to be a matter of time before they can really break through and control it properly.
Luckily, we're seeing new treatments come up. We're seeing new vaccines in there. I think that's a plus for this outbreak. So it's not as people are not as panicked as before. At least there's some semblance of some cure in the works. How would you rate these new drugs and vaccines in there?
Yeah, so 4 treatments are currently being used, all of them fairly experimental, but it seems as though 2 of the 4 are having quite positive effects on the patients. So hopefully out of this outbreak, there'll be a lot more research into those particular 2 to make sure that they can continue to develop them and improve upon them.
For Nigeria, what do you think we should be looking at? We're seeing this happen, it's still far away. We know how the last one happened. Yeah. You guys were at the center of how it all played out. How would you advise authorities in Nigeria to position, or in this outbreak?
I think what's happening in DRC is a cautionary tale for Nigeria, and not just us, all the other countries on the continent as well, because we know that these things easily spread. We know that even in Nigeria, Ebola came here via a patient on a commercial airline. So, it doesn't take much for these things to spread. And so it's very important for us to maintain a level of preparedness no matter what. Even though it's not here now, it could be here tomorrow. So we must always remember to be prepared.
When you look at collaboration within the region, so I know they set up a West Africa center in Nigeria, in Abuja. I'm questioning that because yes, we're a big power in West Africa, but I think shouldn't the location of such a center be somewhere around where there's heavy activity of the virus? Yeah,
I mean that is a very valid point as well. But I think that the reason that Nigeria was chosen was because of our position on the continent and the way we are well respected. And to be quite honest, we did contain Ebola very well, so people look at us as a leader in this space as well.
So what are the lessons we can take from this?
I think the most important thing is to remain prepared. In Nigeria, typically, not even just in health, in everything, we wait till something happens, then we react. But this is not a situation where we can afford to do so. It's very important to be prepared and to look at prevention rather than reacting to something that's already a crisis.
Would you say the awareness level in Nigeria now is much, much better than it was before?
Sadly, no, it's not. I think a lot of people have forgotten, and that's why a lot of the work that we're doing is to remind them that, yes, Ebola is not around, but these things that we were doing at the time need to still be in place and must remain with us as parts of our new way of life.
In the course of your work, and when you go out, and what are the kind of feedback you get from people regarding the Ebola virus?
Well, the one thing is everybody remembers very well what happened. There's no lack of memory. It's just that we've chosen to go back to things as they were before the outbreak. So once we remind people of why it was important to do those things at that time, and also explain to them why it's still important, it's not too difficult for them.
Yeah, because I can remember then everybody were on hand sanitizers.
Oh,
we're big on that. Right now it seems to have disappeared.
Exactly, and that's what we're working to bring back.